This episode will be completely taken out of context. Welcome to the Fact Check This podcast.
All right, Fact Check This daily, and it's cold and I'm tired. So, first night back to work after being off for like 2 weeks, and I did not miss going to work. It's a shame I can't just do this full time and make six figures, but that's not the way this works. And I don't do this to make money anyway. I do this because I feel like shit needs to be talked about. Speaking of shit that needs to be talked about, I've been promising it, and we'll jump right into it. Today will probably be a shorter one of these, just because I am cold and tired. And this one's pretty cut and dry, honestly. But I thought it was interesting. I first saw this, so like a masochist, I sit here and watch the NBC morning news most days, and they were talking about this particular topic, and so I decided to look it up and find some information on it, and it seemed like a good one to jump into. So here we go. This is from the Washington Post. Americans are not getting seasonal vaccines ahead of the holidays. As the holiday season approaches, public health experts are sounding the alarm about low vaccination rates against the coronavirus, flu, and RSV. With gatherings and travel on the rise, many people are heading into the next few months unprotected against these respiratory illnesses, which typically peak from December to February. Experts worry that the unenthusiastic embrace of vaccines could spark outbreaks and increased hospitalizations. Okay. Increased hospitalizations is something that they go absolutely batshit about every single year. And if you go back and look at news articles and headlines for the past 15 years or more, every year around cold and flu season, you start seeing articles popping up talking about how the hospitals are at capacity. They're at 80% capacity, 90% capacity. Now, what's important is that you have to do a little bit more research. Now, what you find out is 80 and 90% capacity does not mean that the hospitals are just overrun with people who are sick and dying of the flu. What it actually means is they're at 80 to 90% of the capacity that they have set aside to use for this. And more often than not, it's not actually for people who are staying there really sick. It's, people who come in to get a checkup and other stuff. There's a lot of statistics that go into it that most of it is fear mongering, but that's neither here nor there. Let's continue on with the article. As of this month, about 37% of adults 18 and older had received a seasonal flu shot, while 19% had received updated coronavirus vaccines, and 40% of adults 75 and older, the group at greatest risk, got an RSV vaccine. The vaccination rates are similar to last year's figures, and the numbers reflect a persistent public health challenge achieving broader vaccine uptake for these illnesses. In December 2023, the percentage of adults 18 and older who had received the flu vaccine was 42%. The vaccination rate for coronavirus was 18%, and only 17% of adults 60 and older had been vaccinated against RSV. This year, that jumped to more than 31%. Coverage was lowest in both years amongst people with insurance who said they are not likely to get the flu or coronavirus vaccines. People in cities and suburbs are more likely to get vaccinated than people in rural areas. Young people are less likely to be vaccinated than their elders. About 9% of children younger than 18 have received this year's coronavirus shot, while 33% have been vaccinated against the flu. To protect infants from RSV, vaccination is recommended during pregnancy, and monoclonal antibody treatment is advised for babies younger than 8 months entering into their first RSV season. As of March, 41% of eligible infants had received the RSV antibody treatment. So some statistics on these particular things that is important to note. So these are low numbers for historical vaccination rates. So, and this is, as it said, these are consistent over the last 2 years. But if you go and you dig up numbers like vaccination rates, especially for flu and RSV, pre-COVID. Usually the flu shot was going around 45 to 48% of adults were getting that. For kids, like school-age kids, 18 and under, usually that number was somewhere in the high 50s to low 60 percentiles. And the adults over 60 was usually upwards of 50%, sometimes peaking out around 60%. So these are very low numbers, historically speaking. And this has been a ongoing trend post-COVID, which they get into. Why do you think that is? That since COVID, people have been more hesitant to go just load up on all these vaccines and stuff. Well, what NBC was talking about, and what the Washington Post is also talking about, as we'll see here, is misinformation. Some of the hesitancy towards vaccines can be attributed to a swarm of misinformation on social media and the internet, which in many instances has overshadowed public health campaigns. There is a large portion of the population that isn't necessarily anti-vaccine, but maybe is hesitant to get their vaccine, said Andrew Staley-Pekoffs, a molecular microbiologist and immunologist at Johns Hopkins Bloomberg School of Public Health. They just don't know what to believe. And when you don't know what to believe, you end up not doing anything. Vaccine hesitancy, already a concern before 2020, worsened during the coronavirus vaccination campaigns and has affected other routine vaccines, experts say. A 2024 survey by the Annenberg Public Policy Center of the University of Pennsylvania found that confidence in the coronavirus vaccine has dropped. The belief that it is safer to contract the virus than to vaccinate has increased from 10 to 22% since April 2021. I wonder what that is. And the percentage of people who believe that the coronavirus vaccine changes a person's DNA increased to 15% compared to 8% in April of 2021. The release of coronavirus vaccines in 2020 led to numerous studies confirming their efficacy and safety. Despite research dispelling many false claims, public mistrust was fueled by mixed messaging and exaggerated claims, causing many people to feel misled, according to medical experts. Also, probably doesn't help the getting their numbers boosted up that a lot of these studies confirming the efficacy and safety have since been retracted or corrected or changed or just all around abandoned. I'm not here to I'm not here to speculate, just saying what has happened over the last couple years. YouTube. There has been a loss of trust in science over the course of the pandemic, said Tara Kirksell, a senior associate at the Johns Hopkins Center for Health Security. There is something here when it comes to what people trust and how it sort of aligns with their pre-existing values and beliefs. It's not just an explosion of information at a person's fingertips that contributes to vaccine hesitancy, Sell said. People are also influenced by their friends and the experiences they encounter in their day-to-day lives. People were asked to do things like close down their businesses for a while or to get a vaccine when they don't feel like they really need those things. And those things affected how people perceived public health, Sell said. The United States invested more than $7 billion in the We Can Do This public education campaign to vaccinate the public and to inform people about the coronavirus. As these efforts have declined, doctors and medical professionals shoulder responsibility for motivating patients to get vaccinated. After the efforts during the coronavirus pandemic, attention shifted to the RSV vaccine, first approved in 2023 as a one-time dose. It is broadly recommended for adults 75 and older, but people at risk for severe disease between 60 and 74 are also encouraged to get the shot. So far, uptake has been low compared with the flu shot. Public health experts say the vaccines are effective, but more people need to get the shot of protection against respiratory syncytial virus. And the thing is, I mean, imagine that. Imagine there being a low uptake on this. after people saw what came out of 2021 and all of that campaign. So then you introduce another brand new thing, and there might be some fatigue more so than misinformation. Like, okay, you just want us to keep getting more and more of these things. And okay, it's supposed to be a one-time thing, but how long before they say, okay, well, it's a one-time thing for 6 months and then you got to get a booster? Or, like, public trust of public health has gone way down. And it's entirely their own fault. Let's not beat around the bush. They brought this on themselves. Paul Isaacs, clinical director of the Division of Infectious Disease at Brigham and Women's Hospital in Boston, said he urges the coronavirus vaccines for his older patients who are more susceptible to severe illness from a virus, but doesn't push it as much for younger patients. If they want to get it, they can get it, and I certainly don't have the same sort of strong message to them as I do the older adults and the ones with a lot of medical problems. And that's always kind of been the case. Older adults, serious medical problems, probably not a bad idea. Maybe. I mean, do what you can to protect yourself. If you're young, healthy, in shape, why? Personal experience. YouTube says they allow this, so don't fucking strike me for this. All through grade school and high school and college, my mom was a preschool teacher. Every year, my mom was required by the school to get a flu shot. Every year she got the flu shot. Every year she would be dog sick for 2 or 3 weeks. Since she retired, she does not get the flu shot anymore. Since she retired, she also does not get the flu and does not get sick like she did. I'm not, causation or correlation is not causation, or, and just because one thing doesn't mean the other thing. But from my personal experience, that's what I've seen in real life. Also, I've literally never at any point gotten a flu shot or any of those other shots. And I have, to this day, in my entire 40 years of life, never had the flu. I don't know. It's also important to mention, as I mentioned before, pre-coronavirus, pre-COVID, adults were usually less than 50% of adults were getting the seasonal flu shot. And the numbers showed that the seasonal flu shots year over year had roughly a 40 to 45% efficacy rate. They were going based off of strands of the flu that had occurred the previous year and what they expected to see in the upcoming year. And that's what they were basing each year's shot on. And so, it's a crapshoot. Spud says, my daughter only had 2 vaccines, and if I had to do it over again, I wouldn't have done those. To be honest, I just lied about her vaccine record. I don't feel bad. Yeah, looking back, I really wish I had been more adamant about not getting my kids a lot of the stuff that they got. It was one of those things that I didn't fight a lot because their mom has always had a lot of health issues. So I didn't want to really push back so much. I've always been healthy as a fucking horse. Have never, but she had a lot of health issues and had concerns that they would inherit some of the hereditary stuff that she had. So, we did all the vaccines and stuff. And in hindsight, now that my kids are, grown and obviously, for the most part, they got my genes as far as their health goes, not as big a deal. Wish I would have pushed back more on it. And especially, learning more as we have over the years and seeing different studies and stuff talking about this stuff. Like, it's understandable that there is more hesitancy with this stuff, especially, they talk about misinformation all the time, but just straight up information, like the stuff that is out there about Pfizer, AstraZeneca, all the big pharmaceutical companies, the number of lawsuits they've had, the amount of money that they've had to pay out because of these lawsuits. Like, when you see all of that stuff, you've got all of this information at your fingertips. It's not misinformation that's leading people to be hesitant. It's the real information that's out there. And it's stuff that would never be talked about without the freedom that we have of the internet to find this stuff, and people who actually come out and talk about it, like Malone and McCullough and Jay Bhattacharya, who's going to be the director of the Department of. He's going to be Fauci's replacement, like RFK. Like, when you've got these people writing books and talking about this stuff, and it's actually like out there, you can find it pretty easily. It's not misinformation. It's just good information. When there are literally stories about doctors who are losing their licenses for no more than the fact that they give their patients the actual data and information. When they're taking away their licenses for telling their patients the truth, and we see those stories, this isn't like a one-off thing. It's happened multiple times. When you see those stories, yeah, people start asking questions, and people start to become a little hesitant, and people start to lose trust. Like I said before, the medical industry created this problem all on their own by not being honest to begin with. It's not misinformation. It's the fact that we're finally getting real good information. So a little white pill bright spot to carry you into the weekend. Speaking of, I hope everybody has a great weekend. I will be back on Monday. I'm trying to decide which one of these. I've got a couple. There's a couple about college. There's one about like clickbait and getting people to bite on stuff on like arguments on the internet and stuff. There's another one that kind of follows up on this topic. The headline is literally "Doing your own research is a good way to end up being wrong." As a matter of fact, I think that's the one we'll do on Monday. So tune back in on Monday, and we'll talk about how you're actually probably totally wrong by going and finding all of that information that the beautiful internet is putting right at your fingertips. Have a good weekend, everybody. I will see you Monday. Later.